All right. Today we have Margaret Cooper with us from SmartShopper, which is a product of our Anthem healthcare carrier here. So what we're going to do today is go through the SmartShopper platform and how that all works, and then we have the opportunity for question and answers towards the end, if that works for everybody. If you have a really important question, just put your hand up, and then we'll work questions in the middle. But we like to try to keep them till the end so that we can get through the whole presentation. So anyway, Margaret.
Thank you so much. Good afternoon. So excited to be here to talk about SmartShopper. It's a benefit provided through your City of Nashua benefits and a partnership with Anthem. So what a lot of members aren't aware of is that the cost of the same medical procedure can vary differently, even within the same health plan or network, or even block to block. And just choosing a network provider in your network doesn't guarantee the cost. So, how do you choose where to go to get the best price? It's really hard to do on your own. So, it may be $600 from a standalone facility, $2,100 in the hospital, but if you don't shop, you won't know where to go, and you won't know the cost until the bill shows up. And then that's where SmartShopper comes in. We shop for everything in our lives today, from blue jeans, my husband's shopping for a home security camera system right now, appliances, but a lot of members don't think about shopping for medical procedures, and it's one of the largest budget items our families have, so it's important to shop around. So that's where SmartShopper comes in. We help you find the right place to go at the right price, and we save you money when you do that. The choice is always yours. When you shop with SmartShopper, we show you everyone in network and local to you, but the choice is still yours. But if you compare the cost of medical services and shop the same way you do for everything else, you're going to save yourself money. You're going to save the city money. That keeps premiums down for everyone. But the best part is we'll send you a cash reward for choosing cost-effective care. So how it works, when you go to the doctor and they're sending you out for a procedure or testing, we don't want to change your doctor, just where you're having testing and procedures done, you'll reach out to SmartShopper. And you can shop online at smartshopper.com, or you can call our concierge team, and I'll talk more about them because I think they're great. Then you have the procedure done at the location that you choose. If that location is cost effective, within about 60 days of your date of service, you will receive a cash check in the mail. Anthem processes claims every day. SmartShopper, we process checks every week, but we do have to give time for the facility and the doctor to file their claim. So we say about 60 days. So what's included in the program? Not everything is shoppable, but common screenings such as colonoscopies, mammograms, diagnostic testing, even some surgical procedures are included in the program. So not everything's shoppable, but if you have something coming up, reach out to us and let us take a look and see if we can save you some money. Here's some examples of procedures included in the program and a reward that you can receive. So, for example, physical therapy is part of your program. $150 is what you can receive back for shopping physical therapy and going to a cost-effective provider. So here's an example of how SmartShopper can save you money. This member has a $2,500 deductible. She's having a few procedures done. She doesn't really know where to go or how to shop. She goes wherever her physician points her to. So she's paying for a scope, a colonoscopy, and an MRI. She's going to pay out of pocket her deductible, the $2,500. Nashua is self-funded, so everything above and beyond that deductible, the city covers. So we're all paying for it one way or the other. It's a cost share program. On the other hand, if that member knew about SmartShopper, she could shop for those 3 procedures. She could choose a cost-effective location. She's not going to be out of pocket her full deductible. The city's not yet to their cost share. Plus, we're going to send that member $585 in cash rewards for shopping and choosing a cost-effective location. Yes, ma'am?
So now, like, after we hit our deductible
So the question was, if I've met my deductible, am I still eligible for rewards? And that's yes. So even if you've met your deductible and your coverage is at 100%, shopping and choosing cost-effective care, again, will save your plan money and help keep premiums down, and you'll still earn that cash reward. It's a great question. The same applies for preventative services. So colonoscopies, mammograms, lab work that may be preventative and covered 100% by your benefits, shop that. You'll still get the reward if you choose cost-effective locations. So you can shop two ways. You can shop online at smartshopper.com, or you can call our concierge team. They're open Monday through Friday, 8 to 8, or our Friday hours, they get off just a little early at 6 p.m. You can always contact them and send them an email after hours, and they'll either reach back out to you by email or by phone, whatever your preference is. So this is just a short video on how to use the SmartShopper program. I'm going to let it run. This is an actual shop completed online by one of our staff members.
This video will show you how to shop online using the standalone SmartShopper environment. Once logged in, click the Procedures tab on the left-hand side. Here you can scroll through your list of shoppable procedures and view the potential reward amounts for each. Or you can search your procedure using the search bar by typing in your procedure name. You can then select the household member the services are for and modify your search by location. The member's home zip code populates automatically by default, but you can put in any zip code you choose and adjust the search radius. Once you've made your selection, click the blue magnifying glass button to shop. Here is how your results are presented to you. You'll be presented with a list of locations from lowest cost to highest. You can also sort your results by total procedure cost or by distance from your home. Each result will provide the name of the facility at the top along with the address and phone number on the left-hand side. The right-hand section will display the estimated cost range for the procedure at that location, as well as indicate if there's a cash reward for that location. A reward-eligible location will display the reward amount in green. The lowest cost facility will earn you the highest reward, and there will be 2 or 3 rewarded locations depending on the procedure type. At this point, the member is now eligible for any rewards displayed if they have the procedure at any one of these eligible locations. Clicking View Details will provide you with a summary of your selection, including the reward amount and a search confirmation number. The website will then prompt you to contact our Care Concierge team to get your appointment scheduled. After you have your procedure, you'll receive your reward in approximately 60 days. Please also note that the member has easy access to the Care Concierge team at any point in the process, right in the lower right-hand corner. They can click Chat to use back and forth messaging or call the 800 number.
So the question was, if you already have a physician and you're looking at surgery, do you have to change your physician in order to use the SmartShopper program? You don't. You can shop the SmartShopper program. We'll give you a list of eligible facilities. Then you can talk to your surgeon to see if they have admitting privileges. Often they may be a surgery center. They can choose to do a surgery at a lower cost versus a hospital. And again, SmartShopper is optional. You're not required to change facilities. What we would really like for you to do is shop before you pick out a surgeon. And our concierge team will actually look at the facility and help you choose a surgeon with admitting privileges to that facility. And that brings us to the next slide, which is our concierge team. They are a group of team members that can shop for you, schedule on your behalf. They will reach out to your doctor. They will reach out to Anthem. I recently had something done, and I think that was the worst part, was sitting on the phone with the facility, talking to my doctor. I didn't have this service, but it's very valuable to me now that I've been through that process. You can actually open a scheduling request online. You go on with your life, your work, your job, your kids, and let our concierge team sit on the phone with the facility and the doctor and help take care of that for you. We had another question?
Well, Mr. Sherman,
Yes.
Just very simply, do rate facilities will follow up afterwards? Somebody was getting recommendations.
Yep, so the question is, do we follow up with satisfaction surveys? And yes, we do. Every member that uses the SmartShopper program will receive a survey from our concierge team to rate their experience with SmartShopper as well as with the facility. Another question?
So what if you've already been seeing a doctor, have ongoing procedures? So like would they?
So the question is, if you've already seen a physician and you have ongoing procedures, you can shop each procedure as you have it done. A good example is lab work. A lot of people have lab work done multiple times during the year. You would shop that each time. One shop is good for one reward. So your doctor may send you for lab work, you would want to shop that. It's time for your mammogram, you would want to shop that. Perhaps you had an injury and you had to have PT for a sore knee, you would shop that as well, all within the same physician. Again, we don't want to change your doctor, just facilities where you're having testing and procedures done.
Can help talk to the doctors about that?
Yes, our concierge team is here to assist you. They can contact your doctor and ask for an order to be moved or sent to a specific facility on your behalf. And again, it's about 60 days from the date of the procedure. You'll have a cash check in the mail. If you are expecting a check and it doesn't show up, please give our concierge team a call. There's a lot of data moving back and forth with claims. And again, our team will reach out to Anthem, request the claim, and get your reward to you if it goes past 60 days. Yes? Great.
If I go again to LabCorp, do I have to call SmartShopper, or will it automatically say, oh, it's part of the SmartShopper?
So the question is, if I shop labs and I receive a reward and I need an additional lab done, do I need to reshop? And yes, you must reshop each time. One shop, the confirmation code that was in the presentation, is good for one reward. So once that shop activity is matched to the lab claim, that is moved out of the system, and you would need to reshop that each time. And we do that because, things change. Although a facility is in network, they may renegotiate their contract and prices change, new facilities open up. So each time you have a procedure done, you can reshop that. But you can shop, a lot of people don't know, you can shop the same day you're having a procedure done. Claims are actually date and time stamped, and our shopping is also date and time stamped. So if you get up in the morning, it's time for your doctor's appointment, you're having labs done, oops, I forgot, just, jump online and complete that shop, give our concierge team a call. As long as that occurs before the appointment, you'll be good for the reward. And you can also shop over a year in advance as well. So if you know you have your mammogram in April every year, go ahead and shop that. Lock that in. May, June, a check's going to show up. You'll be like, oh, that's right, I shopped that last fall when I was at the SmartShopper presentation. So again, the day of or up to a year in advance, but always prior to the appointment. So over 70 procedures are included in your SmartShopper program. Minimum rewards $25. It goes all the way up to $1,250. You must shop, again, prior to your appointment. It also, the other part, it requires the claim to be paid by the Anthem Health Insurance Plan. So if for some reason it's not medically necessary, or you run it through different insurance, or it's a private bill, it does have to be paid by your city health plan in order to qualify for a reward. We send those rewards as a physical check to your home mailing address, so keep that address updated. Takes about 6 weeks from the date of service. And then it is taxable. That's a question I get a lot of times, is it taxable? Well, luckily, only the reward is taxable, not the savings, because the savings is much, much more than the reward you receive. So everything you get is taxable. If you exceed $600 in a plan year, SmartShopper will actually send you a 1099 to help you claim that on your taxes. So what you need to know is it's a great free benefit that you already have. It's included. There's no signing up. You automatically have it. It is very easy to use. I encourage you to call the concierge team. They're amazing. They can help you from beginning to end. And then, of course, they'll follow up with the survey. And it's a cash reward. I don't know anybody whose costs have not gone up, whether it's gas or eggs or anything in between. Cash is king, and that's what this program's based on. So shop, save, and earn cash with SmartShopper. Any additional questions? Yes?
Given the concierge, I mean, we would obviously, we live and work here in New Hampshire, but we wanted to go to Boston and any of the hospitals in Boston. Do we wait and then tell the concierge, you know, this is procedure and this is where I'd like to have it done?
I would call as early as possible. Yeah, reach out to our concierge team as soon as you know you're going to have something done. The earlier you involve them, the more help they can provide. But you can shop nationwide. Anywhere Anthem has a provider network, SmartShopper's available.
I've heard, some complaints of it. When you put your zip code in, it gives you like a 50-mile radius. It's nothing less than that, and I guess, or 30 miles. To me, that seems medium.
Yeah. So the radius depends on the procedure. The more expensive a procedure, the larger the radius. Also, the radius automatically adjusts to make sure that you have good choice in providers and facilities. So if there's only one provider in your area, the radius will expand to make sure you have choice. And then we also have to account for savings. So if there's no savings within a certain area, that radius adjusts. So it doesn't always work out for everything. You may not want to drive 40 miles for a $25 reward on a mammogram, but you may want to drive 40 miles for a $500 reward on a knee replacement. I don't know. The choice is yours. It's not forced. You don't have to travel. You can go stay local if that's what the search results tell you. But we're just trying to give you the information so you can make an informed decision for yourself and your family. Yes, ma'am.
How many times can you use it? So like, it says it caps out at, 1,250.
So the question is there a limit to the rewards you can receive? No, there's not. The maximum single reward is $1,250, but there's no limit to how much you can earn in a plan year or how much you can save. Yes.
Does concierge also deal with dental surgery that you have, that you might have?
So the question is, does concierge help with dental? No, we are medical through Anthem. So it's only medical procedures included in the SmartShopper program. Currently, no dental is included.
Even if the dental requires you to go to a hospital or to be operated?
There are no dental procedures currently included in the program.
And that's the thing, as the list that's on the back of your flyers, that's only a partial list, but there is a little more, but not everything that we're going to do as consumers is covered. So that's where it's always helpful to go online and just check.
Could be.
It's mostly fairly common things that we're seeing here in the city that are on that list, that are, meant to help put money back in your pocket.
Yeah, and generally things you can plan for. This is not for emergent care, it's for, things that are generally planned in advance. Yes.
Specialty RX, what are specialty RX?
So that's, infusion is an injectable drugs that go through the Anthem medical plan. Remicade, if you've heard of Remicade, that's a common one. that they advertise quite heavily on television. If you're on a specialty medication, we would outreach to you. Yeah, that is one where we get a notice, and our team may reach out to you. All the other ones, we rely on you to come to us.
And they wanted blood work or lab tests, would you have to call at that point in time? Blood and labs, or is it covered under the same visit?
Well, the visit is independent. The shopping, again, can be done the same day, as long as it's prior to the puncture. The venous puncture is the CPT code we're looking for, and the mammogram claim. You can shop that morning on your way, or you can shop up to a year in advance. I think we all have lab work done every year. Most of us ladies over a certain age have a mammogram. Go ahead and shop it.
So you would get the mammogram, you would shop with the mammogram, and then you'd have to shop again with the lab?
Yeah, each procedure has to be shopped because the providers are going to be different. Your LabCorp is not going to do your mammogram, and generally vice versa. Yes, ma'am.
Physical therapy, you know, when I went to PT, I was going 3 times a week.
So physical therapy is one reward per diagnosis. So whatever your treatment plan is, that the reward is for that treatment plan. Yes.
Pregnancy?
Congratulations.
I always put you front here, but pregnancy, and particularly the birth of a newborn, may have some medical difficulties.
Yeah, again, it's usually for common procedures that are planned in advance. Yeah, nothing emergent. Children and dependents are included in the program. So if a child's going for ear tubes, for example, or a child is having lab work done, those can be shopped, but not for emergent care. And again, common procedures, things that are common, are generally what's included in the program.
If people have Anthem or have friends and relatives that have that Anthem program but not here, can they buy into this?
They may have it as part of their program.
Can they have it?
Mhm.
So we should
Yeah, it could be available to them already.
I would just suggest they call Anthem customer service and then
Yeah.
ask.
Or they can call SmartShopper, we'll look them up.
Oh, that's,
Yeah.
that works too.
Yeah, Anthem fully insured, the state of New Hampshire, they buy into the program as well. And then several independent employer groups. So I just give up SmartShopper a call, it doesn't hurt to ask. We're nationwide. Yeah.
So, my understanding is that, the information for this meeting, because obviously not everything here is going to be recorded and uploaded to this website.
The reporting team gets on, they make sure it runs through smoothly for them, and then they upload it to YouTube, and then they send me the link. And what happens is the link will go to the wellness page with any documentation. So this flyer, for instance, and then what I'll probably have Margaret do is, if you could email me the presentation too, then
Yep.
they'll have that
Because I can
documentation.
scan this, and when I send my newsletter out, about 1,400 people will be reached that way.
Awesome.
That's wonderful.
You can do that, so.
Yeah. That's really, that outreach is a little more than just the employee base, so it would go in anything employee base, so like the wellness page, for instance, on the, we should probably do a session on that where I pull it up and show people how to navigate it, because it's not easy to find. When I started working, I think it took me like maybe a week and a half to figure out how to coordinate that, but anyway, it is there.
And-
Everything that we're recording goes on YouTube, which is wonderful because then we're able to see how many staff are actually looking at these presentations afterwards. So it's quite wonderful to be able to get that information because we're aware we're so, just about 3,000 employees. That's a lot of us, and spread out, plus our retired
And the more you share Smart Shopper, share your experience with Smart Shopper, be that ambassador for the program, because it's a use it or lose it, right? If we can't get people in using the program, saving money, it's a cost. Your city, your benefits are paying for you to have this extra program. You're not required to do the survey. It's optional.
What does this, so like I don't data exchanges something, so what does the surveys show for smart shoppers, or what does it do? Does that help get more funding rewards available? Or?
Yeah, so your group gets a score. There's a satisfaction score, there's a benefit value score, and then there's a score if you would recommend it to friends and family, and those are reported to the city on a quarterly basis. And then individual feedback on facilities is shared with Anthem. So if there's a quality issue, if we hear from members that it's a bad experience or bad quality for some reason, that's passed on to Anthem and their contracting team.
Can you go into the facility turnaround if it doesn't look to be?
Yeah, of course. Well,
And I don't think that would be the case with any of what we're.
yeah, they're
what
all
we're gonna
vetted.
see.
Yeah, all the facilities are vetted through your healthcare program. We're not going to send you to the mobile MRI behind the KFC. I mean, that's not our goal. Cost and quality do not equate in the medical facility. So think about a colonoscopy. Going to a hospital, checking in a machine in a basement that's been there a decade versus an open MRI facility or an endoscopy center. I had mine done in an endoscopy center in Louisville. It's more of a boutique setting. It's private. They have the brand new machine. But those freestanding facilities often have better equipment, better experience, and they're less expensive.
As a benefit manager, I always said,
Yeah.
that you're paying for their taxes, their electric bill, heating, everything that's encompassing the running of that.
I always say the florist, the cafeteria.
Yeah.
Honestly,
They're-
yeah, but it's true, when you go to a smaller facility, chances are, now, we had,
I think that varies between providers. Of course, you're in the benefit realm. I am too. My provider always asks me in advance for payment. And I said, that's not how my plan works. I have a health savings account. You don't know what I'm going to have done. But oftentimes, it's educating the person behind the desk and just saying, I have an HSA. I'll be happy to give you that card to put on file, but I'm not allowed to pay before I get my EOB.
And that's been the message that I've been sharing, is that no one should be paying without the EOB in
And
hand.
it's
Actually
all
see.
about education, right? Just like I don't have to go where my doctor wants me to go.
that's the thing.
I'm paying the bill. I have a choice. And the doctor should not just care about my physical health, financial health, and stress and mental. It's all part of it. And, if you have a doctor that pushes back on you, you probably need a new doctor, in my opinion. But I'm educated in that space. And I used to credential doctors, and I know there are D-minus doctors working in the world. They're not special. They're not all brilliant. But we do have some. But yeah.
I did have one other question, because this came up and I wasn't sure how to answer it. So it was a colonoscopy question. The employee needed to schedule a colonoscopy and wanted to go through the Smart Shopper process. However, they, in prior colonoscopy, had an issue that now requires them to use a hospital setting due to the issue they had. Would there be any way that they could still attach to that reward based off of a medical history?
We are strictly cost. Yeah. What we can do is provide insight to what that might cost. So if they need to adjust their HSA contribution, for example, or plan for that out-of-pocket cost, we can at least give them an idea of what it would cost. If it's not part of if it's not a reward, you still get information. So first of all, we're a transparency benefit. We just attach rewards to that. So more information, the better.
Any other questions?
All right. Margaret, I want to thank you. I think this was wonderful information and certainly something that we're going to spend the year educating on. We are all in this together is our theme for the year, understanding that, how I use the benefits or anyone in this room uses the benefits affect us all in the end when it comes to what we're paying for cost. So again, thank you all for coming. I am here in City Hall down in the HR office. If anyone has any questions or needs any support with any of the benefits resources that we bring in for discussion, please just stop by. I'm happy to help with that. And I want to thank the TV crew for recording this because I think that is so helpful to breaking down the barrier of reachability with these messages. So thank you.